Have you ever stood in front of your medicine cabinet, stared at all those small bottles lined up, and thought, these pills are helping keep me going? What if I told you that some of the very same medications millions of older adults take every single day have been connected to a higher chance of heart attack or stroke? And the tough part is, most people who take them have no clue about this risk. If you're over 55 and you use medicine for pain, sleep troubles, worry, high blood pressure, or swelling, this could be affecting you right now, not sometime in the future, but today. In this message, I'm going to walk you through 5 very common pills that heart doctors are becoming more worried about, especially for people over 60. You'll find out why these drugs can put extra pressure on your heart and blood vessels. Who is most likely to have problems? What early signs to look for? And most important, what safer choices you can talk about with your doctor and start using instead. Some of these might surprise you, and some could already be on your nightstand or kitchen counter. My name is Dr. Samuel Cross. For more than 30 years, I've worked directly with heart patients, grandparents, retired workers, former athletes, teachers, business owners, good, hardworking people who tried to stay healthy, but still ended up in my office after a heart event that could have been avoided. Over time, I started seeing the same pattern again and again. Many of these folks were taking medicines that helped one problem, but quietly added stress to their heart and blood vessels. It wasn't because they were careless, and it wasn't because their doctors didn't care. It's because medicine can be complicated, and some risks aren't talked about enough, especially as our bodies change with age. After 60, our kidneys don't clean medicines out of the body the same way. Our arteries get stiffer. Our blood gets more likely to form clots. Our hearts don't handle extra work as easily as they did when we were 40 or 50. A pill that feels safe at age 50 can act very differently at age 75. So today, let's talk openly about what you really deserve to know. Let's begin with one of the most common types of pills people reach for. Pain relievers, like ibuprofen, naproxen, or diclofenac. These are called NSAIDs, non-steroidal anti-inflammatory drugs. You can buy them without a prescription, they're easy to find, and they feel familiar. But here's what most people don't realize. These drugs don't just ease pain. They also change how your blood vessels work. They can make your body hold on to extra fluid. They can push your blood pressure higher. And they can make your blood more likely to clot, especially in older adults. Large studies have shown that regular or higher dose use of some NSAIDs raises the risk of heart attack and stroke. Why does this happen? These pills block certain body chemicals, prostaglandins, that control swelling, but also help keep blood flowing smoothly and protect the inside of your blood vessels. When that balance gets thrown off, blood pressure goes up, vessels tighten, and blood platelets get stickier. Picture Mr. Harris, 72 years old, still walking every day and staying active. He started taking naproxen twice a day for knee arthritis. A few months later, his blood pressure crept up 10 points. He didn't feel different at first. Then one day during his walk, he felt tightness in his chest. Was the pain pill the only reason? Probably not. But did it add extra strain to his heart? Very likely. I'm not saying never use NSAIDs, but if you're over 60 and taking them every day for a long time, it's worth a careful look. If you need pain help often, here are smarter steps. Use the smallest dose that works for the shortest time possible. Try physical therapy to build stronger joints and lower swelling naturally. Use creams or gels rubbed on the skin instead of swallowing pills. These go straight to the spot with less effect on the rest of your body. Add gentle habits like walking, eating foods high in omega-3s, like fish or walnuts, and keeping a healthy weight. Your heart shouldn't have to pay a price for easier joints. Next, let's talk about something many people don't expect: some sleep medicines. As we get older, falling asleep and staying asleep gets harder. You wake up at 2 a.m., stare at the ceiling, and your mind won't quiet down. So your doctor gives you something to help. Maybe a benzodiazepine like diazepam, or a Z drug like zolpidem. They can work at first, but here's the concern. These medicines calm your brain and nervous system. They can drop your blood pressure too low at night. They can change your breathing patterns. And some studies have linked long-term use to higher chances of heart problems. Why would a sleep pill hurt your heart? Because your heart and brain are closely connected through the nervous system that controls heart rate, blood pressure, and blood vessel tone. In older adults, that system is already more delicate. Adding a strong sedative can make you more likely to fall, drop oxygen levels at night, have irregular heartbeats, or even raise stroke risk. Mrs. Delgado, 78, started a sleep pill after losing her husband. She felt sleepy and foggy in the mornings. One night she got up to use the bathroom, felt dizzy, and fell, breaking her hip. That led to hospital time, less movement, and more complications. Sleep medicines don't just affect sleep, they affect balance, breathing, and blood flow. Better choices. Focus first on good sleep habits. Dark, cool room, no screens an hour before bed, same bedtime every night. Magnesium supplements, under doctor guidance, can help some people relax naturally. Therapy for insomnia has strong results without drug risks. Often the safest choice is no pill at all. Now let's talk about something many people grab without thinking: cold and sinus medicines with decongestants. You get a stuffy nose from a cold or allergies, so you take something with pseudoephedrine or phenylephrine to breathe easier. These work by tightening blood vessels in your nose to shrink swelling. The problem? They tighten blood vessels all over your body. Your blood pressure goes up, your heart beats faster. For someone over 65 with stiff arteries, any buildup in the vessels, or borderline high blood pressure, that sudden change can be risky. I've seen patients whose blood pressure was under control suddenly spike after taking an over-the-counter cold pill. They thought, it's just for a cold. But your heart and blood vessels don't care where the pill came from. If you have heart issues, high blood pressure, or you're over 65, it's usually best to skip oral decongestants. Safer steps. Use saline nasal sprays to rinse your nose. Try breathing steam from a hot shower. Run a humidifier in your room. Choose plain antihistamines that don't raise blood pressure. Simple things often work best and stay safest. Here's one that surprises many people. Certain hormone treatments, especially estrogen, with or without progesterone, for menopause symptoms. These have helped lots of women feel better during and after menopause. But big studies found that in some women, especially those who start hormone therapy many years after menopause, the risk of stroke and blood clots goes up. Why? Estrogen affects how easily your blood clots. In younger women closer to the start of menopause, the risks look different. But after age 60, or more than 10 years past menopause, the heart and clot risks can increase. Timing, dose, and how you take it, patch versus pill, all matter. Patches often have lower clot risk than pills. If you're over 65 and on hormone therapy, it's worth talking to your doctor about whether the benefits still outweigh the risks for you. Last on this list, certain stimulant medicines. These are sometimes given for focus problems, low energy, or weight control. Stimulants speed up your heart rate and raise blood pressure. They turn up your body's fight or flight system. In a healthy 30-year-old, the body can usually handle it. In a 75-year-old with any plaque in the arteries, that extra work can strain the heart. Even small increases in heart rate or pressure can make the heart demand more oxygen than it gets, leading to chest pain or worse. Let me clear up a few wrong ideas people often have. First myth: if a doctor prescribed it, it must be completely safe. No medicine is 100% risk-free. Safety depends on your age, how much you take, how long you take it, and your own body. Second myth: over-the-counter means no risk. Not true. Many store-bought pills are strong drugs. Third myth: I've taken it for years with no problem, so I'm okay. Risks build slowly. Your body changes. What was fine at 60 may add strain at 75. So what can you do starting right now? Make a list of every pill you take. prescription, over-the-counter, even vitamins or supplements. Put them all on the table, right next to each one. Why you take it, how long you've taken it, who prescribed it. Ask yourself, does this raise blood pressure, cause fluid buildup, affect clotting, change heart rhythm? Is it still needed? Check your blood pressure at home every day for a week, morning and evening. Write the numbers down. Look for patterns. Notice how you feel after taking certain pills. Do you feel flushed, heart racing, dizzy, short of breath, swollen ankles? Those clues matter. Small symptoms can warn you before a big problem. Why does this matter so much emotionally? After 60, life changes. You're not chasing big career goals anymore. You want to stay independent, keep moving, spend time with grandkids, travel, think clearly. One avoidable stroke or heart event can take so much away. And often prevention isn't about a huge surgery or expensive treatment. It's about smart medication choices, removing extra strain where you can. Imagine yourself 10 years from now, walking steady, clear-headed, no cane or oxygen, enjoying life. That future isn't guaranteed, but your choices today, including what pills you take, help shape it. Your heart beats about 100,000 times every day. It never takes a break. The least we can do is not make its job harder than it needs to be. So tonight, when you open your pill box, pause. Look at each one. Ask, is this still helping me, or is it time to talk about changes? Because keeping your heart strong at 60 is much easier than trying to fix problems at 75. Tell me in the comments, how many different medicines do you take every day? You might be surprised how many people are in the same boat. If this helped you, share it with someone you care about, a spouse, sibling, or friend. You could help protect someone's heart. I'm Dr. Samuel Cross. Stay aware, stay proactive. Take care of your heart. It's carrying you through the rest of your life.